green nails, blue nails, and white nails can signal an internal problem, but by paying close attention to how your nails look, you might be able to detect serious problems early. Let's take a look at a few of these problems. Blue fingernails are caused by a low level or lack of oxygen circulating in your red blood cells. This condition is known as cyanosis. It occurs when there isn't enough oxygen in your blood, making the skin or membrane below the skin turn a purplish-blue color. Cyanosis can be triggered by exposure to cold temperatures or by having excessive hemoglobin levels. Cyanosis may also be caused by a chronic disease like cough or asthma, or may be exacerbated by an acute condition like pneumonia or pulmonary embolism because the body is unable to deliver oxygenated red blood cells. Cyanosis is a medical emergency that can require immediate medical attention. Your nail beds may also become blue if you take certain medications, such as antimalarials drugs or certain psychosis medications, as well as drugs used to regulate heartbeat or drugs used to treat rosacea. Blue fingernails are also a result of some jobs. Oxalic acid is sometimes used to clean radiators, and this causes them in mechanics. Ink and dye manufacturers may have blue nails if they use metal cleaners and paint removers. Blue nails can be caused by HIV infection in two different ways. Firstly, the infection itself can manifest in this distinctive symptom. Secondly, blue nails have also been linked to some antiretroviral medications. Most commonly, fungal infections are to blame. As the infection worsens, the nail bed may retract, and nails may thicken and crumble. In rare cases, yellow nails can indicate a more serious condition, such as severe thyroid disease, lung disease, diabetes, or psoriasis. Tobacco also has the potential to turn your nails yellow. Rarely, so-called yellow nail syndrome affects patients whose lungs are severely damaged. This syndrome is often associated with patients over 50 years old, although it has also been reported in children. There is a yellowish hue to the nails of most of these patients. In some cases, YNS becomes inconspicuous over time. A mixture of vitamin E and medication may be helpful. Teres nails are a physical condition in which a person's fingernails or toenails appear white with a characteristic ground glass appearance without any lunula. The condition is thought to be due to a decrease in vascularity and an increase in connective tissue within the nail bed. Teres nails don't require any medical treatment and typically subside as the underlying condition they're associated with improves. Psoriasis can cause pitted nails, which are classic signs of the condition. The nails will have small holes and will peel off. Dermatitis of the fingertips can cause the nail surface to ripple. There are several causes of this form of dermatitis, including atopic dermatitis, irritant dermatitis, and allergic contact dermatitis. There are many treatments for nail psoriasis, including corticosteroid, which can be helpful for most signs and symptoms of nail psoriasis. It's safe to use this medicine once or twice a day for up to 9 months, or you can treat this condition with tazarotene. This treatment can be especially helpful for treating pitting, a separating nail, and discoloration. Older people often suffer from brittle nails. There are many factors that can cause brittle nails, including drugs, trauma to the nails, illness, and deficiencies in nutrients. Brittle nails frequently split. A condition characterized by the splitting of nails horizontally is called onychoschisia. Onychorexis is a splitting of the nails that occurs in the direction in which they grow. Only very rarely are internal disease or vitamin deficiencies the reason. Iron deficiency is the most common. One tip is that if the fingernails split but the toenails are strong, then an external factor is the cause. Basically, brittle nails can be divided into dry and brittle, too little moisture, and soft and brittle, often too much moisture. The usual cause is repeated wetting and drying of the fingernails. This makes them dry and brittle. This is often worse in low humidity and in the winter, dry heat. The best treatment is to apply lotions containing alpha-hydroxy acids or lanolin-containing lotions, such as Ellen, by the Dartmouth Company, to the nails after first soaking nails in water for 5 minutes. Wearing gloves when performing household chores that involve getting the hands wet is very helpful in preventing brittle nails. Cotton-lined rubber gloves can be purchased in stores. If soft, consider that the nails may be getting too much moisture or being damaged by chemicals such as detergents, cleaning fluids, and nail polish removers. Some feel that once-a-week application of clear nail prep once a week may help. Nail polishes with nylon fibers in them may add strength. Be gentle to your nails. Shape and file the nails with a very fine file and round the tips in a gentle curve. Daily filing of snags or irregularities helps to prevent further breakage or splitting. Avoid metal instruments on the nail surface to push back the cuticle. If the nails are buffed, do this in the same direction as the nail grows and not in a back and forth motion because this can cause nail splitting. Biotin taken by mouth is beneficial in some people. Get the Biotin Ultra. 1 mg size, take 2 or 3 a day. It may take up to 6 months to strengthen and repair your nails. There are usually no health risks associated with white spots on nails. Fingernails tend to develop them. The condition can also affect toenails, though less commonly. In most of these cases, the nail plate has been slightly traumatized, what we call simply the nail. If your nails have been sliced against something hard or bent without breaking, they may form a white line or spot. The treatment is quite straightforward in these cases. Simply wait until the spot grows into the nail, then cut it off. Predisposed lines refer to depressed bands or gaps around the nail that stretch horizontally. They usually develop when nail plate growth, which begins in the nail matrix located under the cuticle, is temporarily disrupted. This can occur with direct injury to the nail matrix, an inflammatory condition such as psoriasis, infection around the nail plate, repetitive picking at the nails or cuticles, or even a manicure. Systemic causes include a common side effect of chemotherapy, nutritional deficiencies, illnesses accompanied by high fever, metabolic conditions, and diminished blood flow to the fingers, from Raynaud's phenomenon, for example. Albumin accounts for most of the protein in your blood, and an insufficient amount may have a serious health risk. People with these lines may suffer from liver cirrhosis, a kidney disorder called nephrotic syndrome, chemotherapy side effects, or malnutrition, among other causes. Puffy nail fold infection is an infection of the tissue that folds around the nails. This infection is also known as paronychia, which is an infection of the tissue adjacent to a nail, most often a fingernail. It's caused by injury or irritation, such as a hangnail, cuticle damage, or continually wet hands. Adjacent tissue is painful, red to swollen. There may be pus. Treatments include hot water soaks and medications, such as antibiotics or antifungals. Pus may need to be drained. Green nail syndrome, it's an infection of the nails that leads to a greenish discoloration of nails, also known as chloronychia. This is a terrifying experience. The condition is usually confined to 1 or 2 nails and can involve fingernails or toenails. Since the discoloration is underneath the nail, it will not disappear with bathing or scrubbing. The nail is usually not painful. However, the skin around the nail, including the cuticle, may be swollen, tender, or red. Green nail syndrome is caused by bacteria called Pseudomonas aeruginosa. This bacterium flourishes in wet environments, such as a poorly chlorinated pool, hot tub, contact lens solution, sinks, and bath sponges. When it grows, it produces green pigments called pyocyanin and pyoverdin. 2 major risk factors predispose to GNS. The first risk factor is when a nail becomes abnormally lifted off the nail bed. This is also known as onycholysis. When the nail is detached from the nail bed, the waterproof seal formed by the skin on the nail is lost. This creates a subungual space that collects dirt and debris and may allow an entry point for P. aeruginosa. Trauma to the area under the nail contributes to onycholysis. People at risk for separated nails are gardeners, janitors, and plumbers. The second important risk factor is a damp environment. Dry skin is rarely colonized or infected by P. aeruginosa. Nails repeatedly immersed in water are susceptible. Housewives, dishwashers, cooks, and healthcare personnel may be more likely to have GNS. It should also be noted that wearing tight-fitting shoes for a prolonged time, especially while exercising, is associated with GNS. This has been noted in military recruits and soccer players. Minor risk factors for GNS include nail psoriasis and fungal nail infections. The clinical appearance of GNS makes it an easy diagnosis for a dermatologist. However, if there is doubt, a nail sample can be taken for culture. Green nail syndrome responds well to treatment. Therapy consists of cutting the detached portion of the nail, keeping nails dry, and avoiding trauma to the area. Topical antibiotics, such as bacitracin or polymyxin B, applied 2 to 4 times per day, will cure most patients if continued for 1 to 4 months. Alternatively, chlorine bleach, diluted with water, is effective in suppressing the growth of P. aeruginosa when applied topically to affected nails. Vinegar has been reported to be useful in this regard as well. Occasionally, the nail may need to be removed if more conservative treatment fails. At these times, an oral antibiotic, such as ciprofloxacin, is often prescribed.
Like, comment, subscribe.